Why do we need healthcare reform in the United States? Some people say that our healthcare system is just fine in this country, that it should not be changed. But that is all a lie. Our healthcare needs a serious overhaul. The following story is just one reason why. This is the story of Manny Law, a 24-year-old young man that was left to die because he had no health insurance. On September 17, 2004, when Manny was finished with his shift at Wendy's, he suffered a seizure and was taken by ambulance to Brookhaven Hospital, located in Suffolk County, Long Island. There in the emergency room, he was diagnosed with AVM, arteriovenous malformation. This is a congenital condition in which the blood vessels of the brain are not formed properly. He was immediately admitted to the intensive care unit at Brookhaven Hospital. When the hospital realized that Manny had no health insurance, they wanted to discharge him from the hospital right out of ICU. They didn't even try to downgrade him. No one is discharged from a hospital from the intensive care unit without being downgraded first. Our family argued and voiced our concerns, and they left Manny at Brookhaven for one more day. But they were looking for a place to dump Manny. He was finally sent by our ambulance to St. Luke's Roosevelt Hospital, located in Manhattan in New York City. This hospital specializes in the condition that Manny had. Again, he was admitted to the intensive care unit and was put under the care of Yashinari Nimi and Dr. Alejandro Berenstein. These doctors were supposed to be the top in this field of medicine, but as it turned out, these doctors weren't neurosurgeons. They weren't even neurologists, but they were only radiologists. Nothing was done at St. Luke's Roosevelt, and he was discharged after 3 days. They didn't do an angiogram. This is the procedure which pictures are taken of the blood vessels so that the doctors have a road map to use as a guide. Manny was sent to this hospital specifically to have this procedure done. The doctors gave Manny Dilantin, which is an anti-seizure medication, a Band-Aid if you will, and he was sent on his way. The doctors didn't want to do a follow-up checkup. You see, Dilantin needs to be monitored to see if the drug levels in his blood are within therapeutic levels, meaning that he had enough of the Dilantin in his system to control the seizures. They didn't even give him enough Dilantin. They gave him the 20-day supply, less than 3 weeks. He was scheduled to have his angiogram done on November 4, 2004, more than 6 weeks later. On November 4, 2004, Manny had his angiogram done. They saw the severity of his condition and scheduled him for his first embolization on November 11, 2004, 1 week later. But on November 10, 2004, the day before, the hospital called to cancel his procedure, stating that Dr. Nimi had an emergency and had to go to Japan. I find it hard to believe that a hospital that specializes in these procedures had no other doctor to cover for him. They scheduled him for February of 2005, 3 months later. During this whole time, we kept hearing was, did Manny get his Medicaid yet? In fact, in Manny's records was an order from the Dr. Nimi that states, and I quote, when patient gets insurance, in parentheses, Medicaid, procedure will be performed. Ultimately, Manny was denied Medicaid because $10,000 a year was too much for him to be eligible. On January 6, 2005, we found Manny dead in his bed. He had died of his AVM. Manny's death prompted Christine Queen, Speaker of the New York City Council, and New York State Senator Thomas Dwayne to pass Manny's Law, the Patient Information Act. This New York State law requires hospitals with emergency room to inform patients of charity care or a payment plan available at a greatly reduced price, all depending on patient's income. A New York State Department of Health investigation was conducted, and St. Luke's Roosevelt was slapped with 9 violations. Some of these violations were: failed to properly evaluate Manny Law's severe brain condition, allowed doctors to treat Law who misrepresented themselves as neurosurgeons when they were radiologists, never saw that Law was examined by a neurosurgeon, a specialist who could best evaluate his condition and recommend treatment, sent home without adequate medication or a follow-up plan to monitor his life-threatening condition, failed to keep complete records in Lanza's case, making it difficult to document and follow his treatment. Discharged Lanza without evidence that a doctor evaluated him or discussed his severe condition with his family. Well, that is a brief summary of the horror story that our son Manny and our family went through because Manny had no health insurance. Because of greed, Manny lies in this unmarked grave because we cannot afford a headstone. We urge you to call your congressman and senator and demand universal health care for all Americans. Let's make our system a not-for-profit system again, because what happened to my son can happen to you. Thank you.